When Christina Gilman took her son to the doctor, a new notice appeared in the waiting room, and it got her worried.
Oh crap. And then the second thing I thought was they must have changed billing practices.
Doctor's visits aren't so simple in the Gilman family. Her 4 kids have a wide range of needs, from dyslexia and mental health to autism spectrum disorder and recovery from leukemia.
As a patient, when you're faced with that one issue per visit, it's kind of like, okay, what issue do I address first?
When Gilman tweeted the picture, it touched a nerve.
I think it's really very dangerous. It's dangerous both for the patient and for the doctor.
This family physician calls one issue per visit unethical.
So for the patient who sees that, they are left with having to be their own doctor and having to determine what is the most pressing medical problem. How are you supposed to do that unless you've been to medical school and unless you have the clinical expertise to understand what the body is genuinely saying?
At the heart of the debate is the fee-for-service system that pays 70% of doctors in Canada for each visit. When family physicians have a lot of appointments in their day, sticking to one issue per visit prevents long waits and pays the office bills by seeing more patients. But those like Judy Lewis who have multiple conditions can suffer when the doctor tries to keep the appointment short.
Because he was talking about my blood pressure. And he said, you've had your one issue today, so you have to come back for your headache. It turned out it was shingles.
Some provinces are moving to more flexible payment schemes for doctors, such as a mix of fees and salaries or team practices. This doctor says he simply couldn't continue as a fee-for-service practice if in each appointment he addressed all the needs of his patients, needs which are sometimes better suited to a social worker or a counselor.
There's a wider conversation here about how we resource our primary care physicians for the complex family medicine that we're seeing today, which is very different from any past era, so that we no longer see those notices being posted in doctors' offices.
Okay, Vic, so we heard from a doctor in your piece there calling the one issue per visit rule unethical. I guess the question is it allowed?
Well, according to the colleges of physicians in each province, they're the ones that regulate medicine, and they don't actually forbid one issue per visit, but they have warned doctors that being rigid about the rule could have serious consequences for their patients. And in BC, the college has said the one issue rule is no defense if a patient files a complaint about a doctor.
Okay, it can get complicated from that point.
Exactly.
All right, thanks, Vic.